Prior research on suicide-related behaviors, or SRBs, across sexual orientation have generally found that lesbian, gay, and bisexual people have heightened risks, but these studies have relied on self-reported data and convenience samples. This study advances the field of LGBT health research using a population representative sample of over 124,000 people, each with over a decade of follow-up time. And it uses health administrative data to more accurately quantify SRB disparities. We focus on the most severe SRB events by using emergency department data, hospitalization, and cause of death records. This helps to eliminate survival bias because those who die by suicide who could not participate on surveys are still present in our data. Also, a gender-stratified approach was used to address the differences in suicide behaviors across men and women.
Our primary outcomes were non-fatal and fatal SRBs, identified using the International Classification of Disease version 10 codes. And sexual orientations were based on self-reported sexual identity. We calculated age-adjusted incidence rates and used Cox regression to examine the relationship between sexual orientation and time to SRB events. Here are the age-adjusted SRB incidence rates by sexual orientation. Depending on gender, bisexuals had between 2 to 3.4 times greater risk of SRB compared to heterosexuals, while gay and lesbian individuals had between 2.1 to 2.2 times greater risk.
In conclusion, we provided strong evidence for significant disparities in societal behavior across sexual orientation. More research is needed to identify factors that can protect LGBT people from elevated SIV risk. LGBT people face significant interpersonal and structural discrimination that obstructs their access to healthcare. We show that there is a need to raise awareness and increase training among healthcare practitioners to address LGBT societal risk, encourage the collection of sexual orientation data as a routine part of patient care, and prioritize funding for clinical and social service programs to reduce disparities.